Okay, we had an internet delay, disconnected. So start picking up where I left off. The 5 rights, we were with the right direction or the right communication. I'll pick up there. So look at the right direction of the communication. Are the instructions and the outcomes clearly stated? When should the person report changes? Do we have the right supervision or the right feedback? How can that delegation process be improved? Are the client's goals for care being achieved? And then the right circumstances. Are the tasks that are being delegated possible without independent nursing judgment? So all questions you should be asking yourself as you delegate specific tasks. In developing your delegation skills, we need clear communication. So clear communication is part of the process of developing those delegation skills. Students should try to emulate good delegators. So watch your preceptors, see what their skills, what skills they have. Are they, what skills they're using for delegation? Are they effective? So not everyone is a good delegator. However, you may come across people who you are following, or you may find that once you get on the unit, you have a specific nurse that really does a fantastic job. So it should be a good resource nurse to emulate some of your practices after. Good delegators, they have good communication and interpersonal relationship skills. They make eye contact with the other person. They're pleasant and ask for suggestions. They avoid allowing the person to whom the tasks are being delegated to control the exchange by intimidation or resistance. The delegator may have to teach the person how to perform the task. It's a good idea to make a written list of the responsibilities that are expected, and that does help to prevent any misunderstandings. Also, it's important to be flexible. Conditions change. Clients may be admitted or discharged, so our original assignment may have to be modified. Simulation exercises, both nursing education and nursing services use simulation to increase the knowledge and skills that are required to have effective delegation. Simulation allows that student or the RN to make mistakes and learn from those mistakes. The feedback is really essential to the educational process, and it allows the participant to self-evaluate their interpersonal skills, their communication skills, and also their decision-making skills. So the learning really in simulation comes from the debriefing. Asking yourself what you did well and what areas that you need to work on. So introduction of the simulation, it does improve the critical thinking and decision-making skills that are required for delegation. Careful supervision. The RN must master supervision skills to have delegation, have effective delegation. Monitoring, providing care, and helping them whenever needed. The delegator will teach when they see that there's a lack of knowledge. You can't expect your team to improve if you don't share the information that you have. So the careful supervision and teaching based on what your assessment is of their skills is how we help to build a stronger team. That continual feedback, the ongoing assessment, it should occur throughout the shift. Those that you're trying to help can grow as they see whether they're doing well, or if they need to move, or they need to change something that they're doing. So that immediate feedback does help. Also being nice, just simply being nice and saying thank you helps to build that rapport and those connections. There is a delegation situation. There are certain delegation situations that actually increase liability. So there is a box of information that's in your book. It's labeled Barriers to Effective Delegation. So you might want to review that information. When delegating, you need to avoid assigning tasks that are highly invasive or have a potential to cause significant physical harm to the client. Avoid assigning tasks that are designated under the scope of practice or standards of care as belonging exclusively to the RN. Things like the admission assessment, care plans. Avoid assigning tasks that the person is not trained for or they lack the knowledge to complete safely. And then avoid assigning tasks when there is inadequate time to safely monitor or evaluate the practice of that person performing that task. Legal issues and delegation. Cost-effective care what they tend to do with cost-effective care or using managed care strategies to have cost-effective care is that they actually will use personnel who does not cost as much, and that's awful to say, but they're less costly, less educated personnel as much as possible. So they can disperse the tasks across several people. However, and then what they do is they'll use more UAPs, and then that helps with the increasing the primary increases the use of the RN's skills and their knowledge. So really, by using these cost-saving mechanisms or these strategies, it has caused the increase of the use of UAPs. So one of the major primary functions of the RN today is delegation. So we really need to be able to have or develop that skill. Delegation now you have to remember too, that's not the same everywhere. Some facilities work differently than others. And, some strive to have all RN staff. You'll see a mix of staff, but one of the cost saving mechanisms is or strategies is to use more UAPs. Delegation has advantages. It can free the RN up to help more clients at a higher level. For individuals that tasks are delegated to, it can serve as an incentive to learn additional skills. It can increase their knowledge, develop a sense of initiative, and perhaps even further the desire for far more education. So there are some advantages to delegation. Delegation is performed, if it's performed properly, it leaves accountability and decision-making where it belongs, which is with the registered nurse. Who can delegate legally? RNs must understand the principles of delegation, and they need to know how delegation is effective to help decrease risk of mistakes that may cause a client injuries. So when we look at who is legally can delegate, most state practices do not give delegation authority to dependent practitioners. So that would be LPNs, UAPs. Professionals who delegate specific tasks, they actually retain the accountability for proper, safe completion of those tasks. And they take responsibility for determining whether the assigned personnel are competent to carry out the task. One exception occurs when the person who is assigned a task also has a license and the task fall under that person's scope of practice. So if it's within the scope of practice, then that person is accountable to their own action and responsible for their own action. So RNs have the obligation to refuse assignments that they're not competent to carry out. And they should also refuse to delegate particular nursing tasks to individuals who they believe are unable or are unprepared to perform them. So the legal side of delegation issue has been addressed by the ANA, and the ANA principles for delegation by registered nurses to unlicensed assistant personnel is one of those documents. The direct delegation is a specific decision that's made by the RN about who can perform what tasks. In the indirect delegation, there's a list of tasks that certain healthcare personnel can perform that is produced by the healthcare facility. Indirect delegation takes away almost all of the authority of the registered nurse to delegate personnel different tasks. Yet the RN still remains accountable for those safe completion of those tasks. So the facility may come up with a list of what is delegated, but the RN is still responsible for the safe completion of the tasks. The NCLEX, so you will have questions, of course, on the NCLEX about delegation. The number of questions about delegation on the NCLEX has been increasing steadily. It is not unusual for about 10 to 25% of the questions to deal with delegation issues. NCLEX uses strict parameters for determining delegations. So some tips, although LPNs can do most skills, for the NCLEX, they cannot do admission assessments, give IV push medications, write nursing diagnosis, do most teaching. They cannot do complex skills, take care of clients with acute conditions, and they cannot take care of unstable clients. So for questions concerning UAPs or certified nurse aides on the NCLEX, you want to look for the lowest level of skill required for the task. Look for the list or the least complicated task. Look for the most stable patient and look for clients with the chronic illness.